Recording in progress.
Hello everyone, and thank you so much for joining me for our next drug of the month. And so happy to be part of the Digital Dental Notes family, and looking forward to spending more and more time with you as we progress through the different classes of medications we could talk about. Sort of give you a brief overview of each drug class. We're still in the central nervous system pharmacology cadre, so next we'll talk about sedative hypnotic agents. And you might know these drugs based on the two different classes of drugs that are so appropriate to mention here. The first are the barbiturates. You may remember phenobarbital and secobarbital and all those other truth serum drugs, if you remember, from the 60s and 70s. We don't seem to use barbiturates much anymore in human medicine, still in veterinary, but not so much in medicine anymore because of the side effects. The drugs that we do use predominantly are the benzodiazepines. And they are known as sedative hypnotic agents. What that means is that in low doses they cause sedation, but in higher doses they have a hypnotic effect. Now, in the world of pharmacology, hypnotic doesn't mean, hypnosis. It means sleep producing. So these same drugs in low doses sedate you, but in higher doses make you sleepy. Another valuable aspect of these drugs is that they can also be used in dentistry for conscious sedation, where we can bring the patient to the edge of consciousness, the edge of sleep, but still have them awake enough that they can respond to verbal questions. They'll respond to physical stimuli, like if you touch them on the shoulder, they'll still respond, but they're heavily sedated. And that allows them to maintain their protective reflexes, but still be sedated enough that they're very calm and may not even remember most of the details of the procedure. The best drug I've ever seen used in dentistry for that is Halcyon or triazolam, which has a pretty quick onset and a pretty short duration of about an hour or so, depending. And as a result, you can get the perfect scenario for dentistry. We also use these benzodiazepines in dentistry for anxiolysis. Patients get anxious, and I can understand why. Being in a dental chair is not the most comfortable place to be. You're kind of a victim, if you know what I mean. Sitting there waiting for this maniac with metal instruments to attack you. Okay, it might be a little hyperbolic, but you get the idea. So what are the drugs we use in that case? Well, you've seen Valium, Ativan, Xanax, as I call them, the Z drugs, right? And they have a Z in their name, and so we kind of associate that with, drugs that make you sleepy. Catch up on your Z's or catch some Z's, that sort of thing. But these drugs work by potentiating an inhibitory neurotransmitter in your brain called GABA, gamma-aminobutyric acid. And that's why they do such a good job in, dosing. So low doses, again, sedate you. Higher doses make you sleepy. But make no mistake, my friends, there are drugs that are specifically for anxiety. And you know them to be the SSRIs, as we talked about last time. But even such classic anxiolytics as buspirone or Buspar. Yet at the same time, there are drugs that are truly in the hypnotic agents class. Zolpidem or Ambien, isopicolone or Lunesta. So there are anxiety agents, there are hypnotic agents, and there are, again, the sedative hypnotic agents. So what do you need to know about them? Well, obviously they're used in the treatment of anxiety and insomnia. But as I like to say to my students, and it's, I guess I'm a product of the 80s, it's almost a little bit like spitballing. What do you mean? Well, it's like the drug wasn't really designed to be used for that, but we tried it and it worked, so we're going to keep using it. Now, that may not be the case for seizures necessarily, because obviously these drugs have some muscle relaxant properties that would make them ideal for skeletal muscle relaxation associated, let's say, with some tonic-clonic seizures, that sort of thing. But they're also used for absence seizures and a whole bunch of different seizure disorders. As a matter of fact, in addition to that, Xanax or alprazolam is also used for alcohol withdrawal. So there's a bunch of uses for these drugs beyond just treating anxiety and insomnia. And unfortunately, these are drugs that are illicit drugs, but may be used illicitly. And these drugs are probably, in many parts of the country, the number one predatory drug. So they've got a relative dark side to them as well, because they cause muscle relaxation, so you can't fight off your attacker, amnesia, so you can't remember what your attacker looks like, and so on. Not a comfortable topic to talk about, but I would be remiss if I didn't mention it. As far as adverse effects are concerned, These drugs cause xerostomia, and of course central nervous system sedation, which can be additive with other agents that cause central nervous system sedation. Respiratory depression, that again can be additive with other drugs that cause respiratory depression, for example, opioids that we might use in treating pain. And a curious effect of anterograde amnesia. So not retrograde amnesia, where you take the drug and you forget your past. Many people would like that. But anterograde amnesia means you take the drug and you sort of forget what happens over the next few hours, which could be ideal if you didn't want to remember the specifics of a dental procedure. And I think the people in endo would agree that the best way to get someone to come back for a second root canal is make them forget the first one. And of course, one other side effect of these drugs that's notable is sleep activities. Now, the first time I heard about sleep activities, I'm like, wow, that's being productive. You're asleep and you're still getting stuff done. No, I mean things like sleepwalking, sleep eating, sleep eating, and sleep driving. I've seen that on the New Jersey Turnpike many times. And even, having intimate relations while not fully awake, which you could say about marriage. I'm just kidding, folks, just kidding. So, at the end of the day, these drugs have a good side to them, a therapeutic side, but somewhat of a dark side and a cause for concern. And so I wanted to make sure that we talked about these drugs because how often we use them in dentistry, and also how often they're used in fields of medicine. So remember, my friends, as you've learned these classes, as we go through them together, you've got to be an expert in everything these days to be a dental professional. You have to be an expert in the dental side of medicine, but also the medical side of dentistry. And that means you've got to be good in an expert in all attributes, in all skill sets, to really treat a medically complex patient. So with that, my friends, I'll bid you farewell for this month's Drug of the Month, and I'll be in touch with you soon for our next one. Until then, be well, stay well, and take good care. Thanks.